we are.
Hi!
Perfect. We did it.
We totally did it. Can you hear me okay?
Yeah, that's perfect. Can you hear me?
Yes. I love the artwork behind you.
Thank you. My sister actually did that one, and I did this one.
You guys are so talented. That's
Thank
stunning.
you. Yeah, we were just bored one night, and we were like, we had these old canvases, and we didn't want to throw them out, but we didn't like what was on them, so we just painted over them.
I love that, and I've totally done that before too. I'm
It's
not talented like you are, though.
I love it. Yeah, they're nice. Hers is better than mine, but she paints all the time, so she's a little more experienced.
Practice, right?
Oh yeah.
How are you feeling today?
I'm good. I actually just got back from pelvic floor therapy a little while ago, so that's great timing. But yeah, I'm like recovering from my surgery still, but I'm doing relatively well. Things are better.
Absolutely. It's almost like a wave of fluctuation. I know yesterday was like a really hard day for you. And I know
Yeah,
after my surgeries, I've totally had that too, where it's too much. It's
yeah. And
like a
I
threshold is broken.
yeah, I just got my period again too, and this is my second one post endometriosis surgery. So like that in and of itself, I'm like, what's going on? Way less painful. I think the surgery like helped a ton, but I'm like, what is happening? It's like
Oh my goodness.
been a wild
And
ride.
do you mind my asking who was your endometriosis surgeon? Who did it?
Dr. Shemaya Matthews, she's at Princeton Hospital, or it's like a Penn Medicine, but it's in Princeton, New Jersey. And then my sister also had it. I cannot remember her doctor's name. He's down in Florida in Tampa, and he's like a big guy who like gives conferences and stuff.
Dr. Cinervo.
Yeah, I think so. Yeah, that's who she had.
I know him well, and I'm part of that faculty as well for the endometriosis summit.
Look at that.
Yes, small world.
Yeah,
Endometriosis is this big of a
yeah,
world.
literally. My sister had hers a few months before I had mine, and like I forget what stage hers was. I think like 3 or 4. And as they were already considering me, and as soon as hers came back, they were like, "Yep, there you go. Like you both definitely have it."
Which in some ways can feel a little bit validating, like it wasn't all in your head.
Yeah. No, and especially like growing up with painful periods, and like we're pretty sure our mom had it too, and just like didn't know. And so she would be like, "No, periods are supposed to be painful," and then we're both like, "Oh, our periods are painful," so we're like, telling each other it's normal, and then we just got stuck in this cycle. And it wasn't until like college maybe where I was living with other women, and they're getting their periods, and I'm like, wait, you guys aren't like stuck in bed the whole time, like you guys can still go to class, like what's happening here? And they were like, yeah, it's like not that big of a deal. And I'm like, yes it is, like it's a big deal. But you know what, we're here, we got it figured out, we got it fixed, and now we have the rest of our life.
That's such a good attitude. You
Yeah,
have such a good spirit about it.
I try. I think that's like the only way to look at things. Like, we got handed what we got handed, and we made the best of it.
Absolutely. And like that series of events is like it is echoed across myself and every other patient that I've seen with endo, is where it's like, because it has that genetic component, we learn what's normal. Like we learn when we have a fever to lay down and take Tylenol or whatever. And we also learn that when you're knocked out, like this is how it goes to be a woman. Like this is how it goes to.
My sister has, and this is what my mom has. So like, this is just normal. And it's like, no, it's not normal.
Not normal.
Not at all. But now we get to help tell other people, that's not normal. Let's get that addressed.
Absolutely. And you and your work is, I think, part of the crescendo that I've seen in healthcare of people explaining their journey and sharing their journey in a very honest way that is leading to a lot more awareness and people seeking treatment so that we can actually do our jobs as providers. And I cannot thank you enough. I think that it is the most powerful thing I've ever seen in healthcare, because you're reaching people that we're not.
Yeah, and I have so many people in my comments, in my DMs, who are afraid to comment, that are like, thank you for these videos. Like, it's because of you that I realized that something was off, whether it was the same issue or a different issue, but just something was off. And then they started going to pelvic floor therapy or seeing a doctor, or even like questioned their gynecologist a little bit. If the gynecologist wasn't as familiar with pelvic floor issues, it kind of gave them that like, wait a second, maybe I should get another opinion.
Absolutely. Absolutely. And on top of that, you have POTS.
Yes.
And I don't think a lot of my viewers, because that's not a condition that I cover a lot. Do you mind explaining POTS? And then I'll also say you brought to my awareness your physician who you finally found. And now I'm following him on this
Yes.
account. So
Yes.
if you want to, he is phenomenal.
Dr. Pache, yes. So POTS stands for postural orthostatic tachycardia syndrome. And I usually describe it as being allergic to gravity. That's the simplest way to put it. But think like when you stand up too fast, it's kind of like that, but all of the time. And in my case, you actually do black out sometimes and you do pass out, whether you stood up fast or not. Like I could stand up as slow as possible, and just that change from being in a seated to a standing position, my body takes as a threat for whatever reason, and my heart rate spikes and my blood pressure drops. And for me, it's more of a blood pressure issue. Like my heart rate, it gets high, like it gets like 130, 140, but I know other people who go up to like 180, like 190, like dangerous levels. Whereas mine is that my blood pressure drops really, really low, and that's what makes me pass out. They also did find out recently that I have a hole in my heart, so they're looking to repair that. And then they're like, you still have POTS, but this might also be adding to how much I pass out.
Yeah.
Uh, they're like, either way, you still have POTS. Like you're still gonna have to deal with POTS even when we fix that. And I'm like, that's fine. Whatever. But yeah, so that's pretty much what POTS is. And I and a lot of other people, and I talked to my endometriosis doctor about this, she said a lot of her patients as well have POTS, and usually the week leading up to your period is the worst. And so you're extra dizzy, you're extra syncope or pre-syncope, like almost gonna pass out or passing out. Not always so much when you're on your period, but leading up to it. So that's how I always knew that my period was coming, because I just started feeling my POTS symptoms worsen. And it would be for like a week straight, not just like one bad day. And I'm like, what is happening? And then I started getting my period afterwards, and I was like, oh, this is correlated to me. Like, and I've seen a lot of other people talk about that as well. I don't know if there's an actual medical correlation just yet that they've found, but it seems to be a reoccurring theme amongst POTS patients.
Isn't that interesting? Because with endo, there's a lot of, we call them comorbidities, which is a
Mm-hmm.
really morbid word.
Yeah, more, yeah.
Co-occurring conditions, including bowel and bladder.
Mm-hmm.
But it's really interesting to me the more I learn about the vagus nerve and vagal nerve connection and disruption between the abdomen and inflammatory conditions and the rest of the body. So what you're saying to me makes perfect
Yep.
clinical sense.
Oh, I'm glad.
And it also is like, come on, are you kidding? Like one more thing.
After another,
Enough is enough already.
it's
Oh
crazy.
my goodness. And so do you have a PDA, a patent ductus arteriosus? Do you know if that's the term they use for the hole in your heart?
It's
Is that
PFO, a patent formal ovale, or I
okay?
definitely that up, but PFO.
Interesting. And it's, I mean, do they think you may have had it since birth, that this is a
Yeah,
long standing?
mother actually had one at birth that they saw, because I guess it was like big enough to see, and it went away after like a week. They didn't have to do anything. They never saw mine, and my doctor now just basically said, it could have been so microscopic at the time that it's not anyone's fault that it got missed. It was something that they couldn't see. And then what brought it to his attention was that I ended up in the hospital a couple times with stroke symptoms. And he said, anytime like a 20-something-year-old comes in having had stroke symptoms, I automatically am like, they need to get checked for a PFO, because why else would this be happening? And he even said, like, they do specialized testing at his office, like POTS specific, and that like him and a team of other doctors made up. And he was like, your stats align with having POTS, but they're a little too out of control, that he was like, there has to be something structurally wrong that's adding to it. And I was like, didn't love to hear that, but I was also like, if there's a root cause or like a reason, like that's fine by me. Like figure it out. And we did. So now I have a consult in November to talk about repairing it. Yeah.
Wow. And
Yeah.
it'll be another interesting chapter.
Oh yes, very interesting. I feel like now I'm at this point, I'm 29 years old and we're finally figuring out like my health issues. We figured out that I had this hernia that was causing all of these problems, removed part of my intestines. I had the endometriosis removed. In that, they also found like a couple of they're like balls of inflammation, which my doctor said she had never seen anything like it. She had gotten like consults from other people, just this big white ball, and they were like waiting for pathology to come back. They're like, we don't think it's anything bad, but like we have no idea what this is. And it was just a big ball of inflammation that was also like pressing on my pelvic floor, we think. And I like now I'm slowly getting all of these things done within the last like year, 6 months even. And I'm like, oh, like we're finally figuring it out.
Wow.
Yeah.
That's amazing. And it sounds like you have healthcare providers that won't stop searching. It's like,
Yeah.
this is the first time she's seen this type of inflammatory process, and she's going to be calling in other consults. That's incredible. That's who you want on your team, is people that if they don't know the answer, they are going to find the people that do.
Exactly. And it's actually my pelvic floor therapists have been the ones who have like led the charge for me. Especially my pelvic floor therapist, Maggie Link. I don't know if you know her, but she like is the one, when I moved back to New Jersey with my parents, I started seeing her. She helped me like find a new team around here. Like I saw one doctor I didn't really like, and she was like, we'll find you a new one. Like, there is something wrong, because even in pelvic floor therapy, I wasn't making progress like I was supposed to be doing. She could get my pelvic floor to relax, but by 2 days later when I'm back, it's like back to being like square one. And she's like, this shouldn't be happening. Like, what is going on? So then she got me in with a urogynecologist, which was a very interesting experience. And, they helped me. They did trigger point injections, things like that. But it wasn't until I got the endometriosis removed that things really started to change. And now when I saw her, I had to wait like 2 months after surgery before I could go back. But immediately she was like, this feels completely different. Like, you can just notice the difference. And my gynecologist said the same thing at our like post-op, thing. She was like, she's like, we all remember what you feel like, because it was one of the worst things we've ever felt. Yeah. And now it's like a world of difference. And now I do the exercises in PT, and like I'm actually able to hold them. And like the next time I go back, it's not back to square one. Like it maybe like tightens up a little bit, but it's not like we're starting over every single session.
Absolutely. And along those lines, I love that you just brought up your exercises, because exercise is a cornerstone of pelvic health physical therapy. But when someone has endo and POTS, we have to be working to find what works for you in terms of your body's position against gravity, as you mentioned, and then also the moderation of it. Like, we cannot just be asking you to go out and go for a 15-minute walk. That may not be working for you.
And there's so many factors, like what's the temperature that day? What's the barometric pressure? Am I going to pass out outside? Like, there's where you live, like the weather's different. And so it can be really difficult. One of the things that I started doing, my friend got me into aerial yoga with the aerial silk, and we actually have one in my house now. So I do a lot of exercises in that, and that's much easier on my POTS, because, whereas other people wouldn't hold on to the silk and they'd be doing it, I get to hold on the whole time. So like I feel stable and like I'm able to do things. And, it being the safety of my own home, I'm like feeling a little bit better about trying things.
Yes.
And even pelvic floor therapy, like I've learned how to do happy baby in the silk. Like I've learned how to do those things, which makes it even easier on my body to hold the position without actually having to hold it, because the silk is holding me in it. And that like has opened up exercise that much more for me.
I love that so much. Was that your suggestion or Maggie's?
No, that was actually my friend. She actually just commented. She's in my live. It was just a friend of mine. She wanted to go. They had it in Princeton, which is like kind of near where we live. And we just like started taking classes and we got really into it. And then Maggie helped me, figure out more positions that I could do in the silk to help myself.
This is mind blowing. I love it so much because it's one of those things that from a healthcare standpoint, we'd be like, okay, but you don't tip back too fast.
Yeah, exactly.
And
This,
you,
it's perfect. You're supported the entire time. Like I've only passed out like once while doing it, and that's because I was like trying new things and like pushing it. But even so, like I'm never gonna get hurt because any position I go into, I'm like wrapped in it so safely that I could pass out upside down and I'm still not gonna fall out of it. Yeah, but
like a little bit.
it's safer. Yeah, so it's like I was able to try things and see how far my body is progressing and able to do certain like movements because I had the safety of the silk.
That is phenomenal.
Yeah. But I'm really good about doing my pelvic floor exercises. That's my main form of exercise.
Yes.
Yeah.
Absolutely. And then also you use the wand.
Yes, I literally have both right here. I have both these. First one. I got this when I was still living in Philly with my first physical therapist, and she's the one that introduced me to it. And I loved it so much. And then when you guys came out with this temperature one, I was like, I have to have it. Like, I have to have it. And I use the heat mostly because I don't always need ice to make everything colder. But um, heat really helps me like relax, and it's very comfortable. And sometimes even without doing actual exercises with it, just the heat alone in there helps. But I love those things. I recommend them to everyone, but then I have to be careful because I'm like, but you have to learn the right way to use it. Like, there's like exercises you should do properly with it so you hit the right points. And that's what physical therapy really helped me with. Like Maggie taught me how to use, like I bring it into therapy. I still bring it in half the time. And like she helps me, figure out ways that I can do it at home and get to the right positions and angles so that I can do a lot of it myself.
Absolutely. And that is like the perfect intention of why I made the wand is because it's meant to be a tool to empower you to be able to manage at home. And eventually when you graduate and discharge from physical therapy as managing on your own, but bringing it to your session is incredibly helpful because people don't have a brain map of their anatomy. They don't understand where their tender points are located. So bringing it in and having your pelvic PT show you on your body, show you on the model, put the pelvic model over yours while they're doing the work so you can feel it and you can form this new map in your brain of where you're going because it's very disorienting seeing something.
Oh, you're like going the opposite way of like where you need to go. But then once it clicks, like once you start figuring it out, it's just like the whole world changed. And I'm like, oh, I can do this myself. And like there was a while where, insurance was giving us a little bit of a problem and I could only go once a week versus I was going 3 times a week. And this was pre-surgery. So like my body wasn't holding it well. And I was like, thank goodness I have these things to try and do it at home as much as I could. Even I couldn't make it perfect, but like that was the only thing that was holding me over in between sessions.
Oh, goodness. I'm so glad to hear that. And it is just that little bit of a bridge to help people get through.
Someone asked if this could help with bladder incontinence.
So, interestingly enough, incontinence can be driven by a couple of different types of pelvic floor muscle function. I've got this. Everyone just keeps the pelvic model sitting there in their living room, right? So, incontinence can be driven by different types of pelvic floor muscle dysfunction. So, everything we see in red here is pelvic floor muscles. The organs sit in the bowl, and I'm going to dump them out. And then there's another deeper level in there. And so incontinence can be caused by muscles that are either too weak or don't have enough timing and control to activate and close when you're coughing or laughing or sneezing. On the other side of that, it could be that they are too tight. They don't have good mobility. And that's yes. Yeah. And then when you cough and sneeze, there's a gap around the urethra. For that group of people like you that have pelvic floor muscles that are too tight, the wand is a helpful tool to manage incontinence. If it's driven by this other side where we said it's timing and control, then that type of incontinence requires muscle training to activate strong and quickly, because when we cough or sneeze or laugh, we need those muscles to turn on quickly. So it's two different drivers. And for that reason, if you're experiencing incontinence, it's a really great idea to see a pelvic floor physical therapist or occupational therapist to determine which classification you fall under and then to train it appropriately.
Yeah, my issue is definitely everything is too tight. And I wasn't having bladder incontinence, I was having rectal incontinence. So that was more of an issue. But all of it was just driven because everything was so tight. Like just everything. I was in constant pain. I started doing Valium suppositories at one point, and that changed my life. I literally I put it in and I was like running around my house asking my sisters, I was like, is this what you guys feel like? Like, is this what it's supposed to feel like? And they're like, yeah. Like what do you mean? Like, I didn't know like how tight it was until I actually put a muscle relaxer in there and it forced it down, which isn't a solve, but it's a little band-aid. Definitely made me much more aware of like how my body should be behaving, and it simply wasn't until now it's starting to, and I can feel the difference, and I can feel it when it starts to tighten up again, and then use the wand and do my exercises to get it back to what I now know it should feel like.
Isn't it interesting when you feel and your brain registers normal or close-ish to normal resting state? It's really amazing.
It's crazy. I've gotten both of my sisters to go to pelvic floor therapy. They've both like pretty much graduated from it now. Their issues, not downplaying them, but they were not what mine is. And for a few sessions, they were able to get that awareness. They both have pelvic wands. They're able to do that on their. Maggie taught them how to use them, and now they can manage it on their own. I think they go back every couple months or something for like a check-in. But it made a huge difference in our lives.
Oh, I'm so glad.
I know. I'm like, we can't get ours confused, guys. Everyone keep yours. Yeah.
Keep your bag labeled.
Yeah, our little bags.
Yes. Maybe put some fingernail polish on the rope part on the outside or something.
Yes,
color code them.
Mine. This is mine. Don't touch it. Yes. Funny.
Oh, it looks like we have a question about the main benefits of the temperature wand. So we have all these different types of wands. Yes. And the temperature therapy wand is a great tool for people who really respond well to thermal modality. So if you're thinking about how you would handle like a headache, if you're one that responds really well to a hot pack or a cold pack, or if you have a very inflammatory process in place like endometriosis, this is a wand in endometriosis yellow in honor of endometriosis, because that was the group that was really encouraging me to look for a way to get thermal therapy involved with the wand. So it can be placed in the freezer and it will maintain that cold temperature for people that respond really well to ice and to cold. And then it can be like Jules and I, with warm water, hot water, to retain a warm temperature to help relax muscles in people that respond really well to warm therapy. And that is me. I'm like a lizard. Warm is helpful for.
I used the ice once, and it was after I got my trigger point injections, and everything was very like inflamed and swollen. So they're like, try and put ice on it if you can. Like, we know that's hard. And I was like, oh, don't worry. I have a pelvic wand that turns cold. Like, I'm good. Like, you don't have ice. But outside that I'm always using the heat.
Yes. Did it help on that particular day?
It did so much. Really? Like 2 days in a row, I was just icing it. It was perfect though. I think I fell asleep one day.
Oh, that's good. Rest is a really helpful medical tool.
It is. Someone asked, how long have I been using the wand? So I got it with my first therapist, and that was when I was still living in Philly right before COVID. So like early 2020. So 2.5 years. But that being said, we didn't fully know what was going on with me at first. And then we slowly figured that out. But it has helped me the entire time just get any sort of relief. Even before I really learned how to use it, just putting it in and trying to move things around, I was like, okay, I'm at least like, I would hit a spot and I'd press on it and I'd be like, okay, that feels relieving. I'm just going to keep doing it. Like whatever works. Now I found the actual, you know, trigger points and things that I should really be pressing on.
Absolutely. Did we have other questions that we're sliding into? I keep seeing, this is my first time in TikTok live and there's things happening above and below. I'm used to Instagram.
It's like playing games and stuff. I'm like, what is happening? Yeah, no, the only thing that I think is weird about TikTok, whereas Instagram, I think we can see both of our comments on Instagram. Like it's a shared chat, whereas here you have one chat and I have another chat.
Oh, interesting. Okay, that's really good to know.
Yes,
Okay.
whatever you're seeing, I'm not seeing. And you're not
Oh,
seeing what I'm seeing.
that's so interesting.
What does it help with? So it can, in my case, it can help with, you know, finding trigger points, pressing on certain muscles to help like relax and release those muscles to get to a more relaxed state, which is where it should be in, and mine is just not. I think that's all the questions I have on my side. Unless anyone has some more, feel free to send them in.
And that's all the ones I had too. I didn't see any others coming in.
Would this be useful in some way after having a baby?
Yes, yes, it can be. I'm going to demonstrate with the vibrating wand for that one. So, as we know, there's a lot of different ways to have a baby. And interestingly enough, we think about C-section and we think of vaginal delivery, but there's a million interesting things that can happen in those processes under both of those conditions. So namely, remembering that even though you've had a C-section, if you were pushing prior to having like an emergency C-section, your pelvic floor muscles may also have been injured. You may have sustained a little tear. They may be feeling sore. And then with a vaginal delivery, certainly if you experienced a tear and some stitching, or if you had an episiotomy, there's scar tissue in there afterwards as well. And then the pelvic floor muscles can also become tight, very similar to how Jules is describing it now as a product of guarding to protect after that vaginal delivery because, oh my goodness, it hurts. I've had two. But here's the perineum. So here's the vaginal opening here. Here's the perineal body here, and oftentimes there's some degree of stretching, if not tearing or episiotomy in this area that can be really tender. And so for that, vibrating wand has 10 frequencies of vibration. Vibration's been shown to help improve blood flow to the tissue and then also help to help the muscles relax. And so you can be using this end right here on that scar tissue. I would always recommend starting first just with your finger to start getting it used to having something touching it and desensitizing it in that way. And then you can be using this just to gently be working on that scar tissue to make it softer and more flexible and pliable, which is a really big deal when it comes to considering having intercourse again or using a tampon again, where that tissue can be really, really sensitive, if not downright painful. The other thing can be to be relaxing the muscles around it. So the wand can be used either end, and it can actually be used rectally or vaginally, and addressing any colorectal problems, rectal pain, tailbone pain. Yep. So it can go in like this. It can also go in like this, and then you can loop it through and be addressing, doing some release, some massage onto the deeper pelvic floor muscles in that way. So yes, that's a very long-winded way of saying it is very helpful postpartum.
It's helpful for everything. Yeah, we do a lot of rectal work. Now I actually I separate my two, and I'm like, okay, this one's for my vagina and this one's for my butthole now, like all the time. I mean, I use them both for both things, but now I'm like, now that I have two,
we've got options.
Yeah, we've got options. We've always got options. Someone asked, what made you originally know something was wrong or different down there? So for me, the way I ended up in pelvic floor therapy was like kind of weird. My GI doctor at the time was like, oh, you need to work on diaphragmatic breathing. And he was like, so I'm going to send you to a pelvic floor therapist because like they're really good at it. And he was like, you also do have a small rectocele, like a rectal prolapse, which now over time, you know, we've learned that I had much bigger issues. That was just the one that they could see, but it doesn't seem to actually be that huge of an issue. But that's what sent me to the pelvic floor therapist. And then she did her evaluation and was like, whoa there, like there's more going on. But you know, my previous gynecologist had never said anything. I would complain about pain in general, pain with intercourse, things like that. And they were just like, relax, have some wine. I'm like, I don't drink. And then it was just like, well, just get out of your head. And I'm like, something just doesn't feel right. Like it felt like my questions were never getting answered. There was never like a solution. I'm sure many people have seen the BuzzFeed article that was about me. Like I was not actually having orgasms. I thought I was, but I wasn't. Just nothing ever seemed to be the answer until I got to pelvic floor therapy and actually started doing those techniques. And even if it was only for a little bit that it worked and then, you know, reverted back, I was still then learning, okay, it can feel different. And like, this is the way it's supposed to feel. And that's the goal, to get to that feeling relaxed. And now we're successful.
And once you've learned how to relax, then you can work on some of that response. And that does directly affect sexual activity and enjoyment and participation, all of that. I'm pretty proud of your gastroenterologist who was aware that we do. I mean, because usually they're thinking about how we handle bowels and constipation and those kinds of things. So I'm a little bit blown away by this knowledge, because it's a very important part of what we do, and he referred you specifically for that, and that allowed us to do what we're most known for, which is the pelvic floor evaluation.
Yeah, but I still feel like it was a little bit of an accident where he was like, they'll help you with your breathing, and I'm like, my breathing? Like, what are you talking about? Like, I'm breathing fine. And he was like, no, it's different. And I'm like, okay, whatever you say. and then and then I got there, and it really helped.
And that's a testament to you for showing up too, because that's not a very good reason. I mean, especially with all the dealing with, but you were ready to do anything at that point.
Yeah, at that point, I was literally like, you could tell me a random doctor, and I'd be like, okay, I'll make the appointment. Like, I'll go. Like, whatever works. And I at first thought he was kind of like pushing me off, and I was just like, oh, I don't want to deal with you anymore. Like, go to physical therapy. And I'm like, physical therapy for like my butt? Like, what are you talking about? And he's just like, just go. And I'm like, okay. And I'm so glad I did. And then COVID happened, and so I wasn't able to go for a bit. And during that time, I ended up moving back to my parents' house anyway. And I'm really grateful I did. I mean, I loved my first pelvic floor therapist. She's the one that, you know, opened my eyes to all of this. But working with Maggie has just been really, really great. She's taught me so much. And I tell her all the time, I'm like, all these educational videos, like, they're thanks to you. Like, you're helping me learn and like empowering me to teach other people, which wouldn't have been possible before this because I didn't even know that it existed.
Absolutely.
Someone asked, what if it's been a few years since birth? I found working out, even light workouts, are extremely painful. I think it's never. This is your area. I mean, I didn't start at 28 years old, so.
Yes. It is literally never too late. I promise you, I have treated 95-year-old men and women who have, like, it improves quality of life throughout the lifespan. So it's really never too late. So make that appointment.
Yes, definitely. Someone said, this is so informational. Y'all have me sold. I have pudendal neuralgia. Am I saying that correctly? They introduced me to the pelvic wand and to try to relax the pelvic floor.
Awesome.
Definitely.
Yes, pudendal neuralgia is, it can be tricky because the pudendal nerve has a lot of bends and wiggles throughout the pelvic bowl. That's exactly what it does. It just bends and torques. So there's multiple ways that it can become restricted or in some cases entrapped. And so yes, the wand and manual therapy and certain exercises to help gain mobility around the pudendal nerve can alleviate a lot of those symptoms that are highly unpleasant.
Yeah, they said it's very, very painful. Someone does it help with urinary incontinence? It can. So it depends on what your reason is for having urinary incontinence, whether it's that your muscles are too tight or too loose. If it's too tight, it can help with it. If it's too loose, you might need the other types of tools. But you know, all of Intimate Rose's products can help. You like cover it all. No matter what the issue is, there's a tool for it.
Exactly. We've got a solution for everything.
I mean, I used to think all the time, like I had to do Kegels, whatever you call them. I was like, oh, this is what I should be doing. And I remember I read like a BuzzFeed article about like vaginal weightlifting. And I was like, oh, that's so cool. And then I'm like, I need to not be doing any of that. Like that is the opposite direction that I need to go in.
Yes, exactly. Kegels totally have their place for strengthening people that have very weak or underactive muscles, but that is contraindicated for people that have muscles that are too tight. So, yeah,
I was
absolutely.
just see it on the internet. People would be like, make sure you're doing them. And I was like, okay, that doesn't really feel good. And then it was like, stop doing those. Do not do those. Like, no, like that's not for you. And I was like, oh, thank goodness someone told me. So now I'm trying to people when they're like, oh, you should do them. And I'm like, maybe you should get an appointment first and make sure you really should be doing them. They might not be right for you. They were not right for me.
That's exactly right.
Do you have a solution for fibroids?
So, fibroids require complex medical management and a team, namely a gynecological specialist and at times a consult with the gynecological surgeon to determine management of the fibroids themselves because of the way that they affect the uterus. And then absolutely working with pelvic health physical therapy to address the pelvic floor muscle dysfunction that can occur as a byproduct of the pain that you're in. Those are not fun. I know that 100%. And oftentimes it is very similar to what we're talking about here. The muscles guard and they tighten and they shorten to protect you and to help,
hold everything
movement around that uterus because it's giving you your brain signals. So it is going to be all of the above. It's not going to be just one fix, but managing pelvic floor pain and myalgia with pelvic health physical therapy and tools is one part of that robust treatment plan.
One of my friends,
oh, go ahead.
Can we make an Intimate Rose crown for Jules because she's the queen of these?
Yes, we can. We will make it happen. We will find one.
Crown.
Well, that was a unit.
I can't hold them all. And then someone else said, just curious, is this helpful for exercise or can this be used to help with splinting with bowel movements, which we did not talk about, and I use it for that too. I have done lots of splinting. I used to just do it with my fingers because I didn't really know I didn't even know that it was called splinting. I was just like, something hurts and this feels better while I'm trying to go to the bathroom. And then it was actually Maggie she was like, you need to look up splinting because you're already doing it. And she's like, and here, like you can do it with the wand. So for a long time, one of my wands was in my bedroom and the other wand was in the bathroom.
Absolutely. So for those people who are wondering, so as you can see here, the vaginal opening and the rectal opening are right next to each other. And then inside, what happens is the vaginal canal is a circular tube, and so is the rectum. And they share this little fascial tent of tissue in between them. And so if you're having pain or difficulty with bowel movement, we are addressing pelvic floor muscle relaxation around that. But another thing that is helpful if you're envisioning the vaginal canal up here and the rectal canal here down here is to use the wand inside the vagina to come through and scoop to help with the bowel movement through the vaginal canal if you're having difficulty. And it is advisable to learn how to do it with the help of a pelvic health physical therapist. You can use your fingers to scoop in through, but the wand is a helpful tool to help with.
Definitely learning the right way to do it, much more beneficial. At first, it was just shot in the dark. Just trying to make myself feel better, but actually learning how to do it made a huge difference. And like now it became more of a routine. I don't need to do that like as much anymore. I don't think I've done it in a couple of weeks. But for a while I was doing that and it helped a ton.
That's a good sign. Yeah. That's great.
Progress now post-surgery.
I had one question up here. Are the wands helpful for prolapse and rectocele. So they can be.
Mm-hmm.
And prolapse, such as cystocele and rectocele, is when the pelvic organs have dropped down into the pelvic bowl. It can happen with people who have chronic straining with constipation. It can happen after pregnancy and after vaginal delivery. And for each vaginal delivery you have, your
More.
percentage chance of experiencing it goes up, interestingly enough. But the wand can be used if you are overusing the pelvic floor muscles to try to support those organs that are pressing down. You can develop some myalgia, some muscle tension, and some trigger points in it, and the wand can be very useful for that. And then people with cystocele and rectocele often have difficulty with defecation, the same way we were just describing, and it can be used to splint to better support that tissue during bowel movements as well.
I've definitely used, there's been times where my rectocele is like very heavily pushing into it when my colon was full, and I could feel it, and I would just be like, okay, wand's going in. Gotta move this stuff around.
Yes. I think that's all of my questions there.
Is it covered by insurance?
Pelvic floor physical therapy is. The devices are interestingly in a classification for personal use, so they are not yet, but don't you worry. Before I will make it happen. It's on my list of things to do. It requires a lot of educating of and legislation information and things like that. So it's a long-winded way of saying pelvic floor physical therapy is covered. The devices are not yet covered. However, you can use your HSA if you have one, because it is a tool that is advised by a medical professional. So you can use an HSA account to cover our tools. And I'm trying. I'm working.
You're trying. You're gonna get there. You're gonna make it happen. Someone said, I just joined. Can you do a summary, please? I have endometriosis. Yeah, basically, we've just been talking about my journey with endometriosis and pelvic floor dysfunction and my other stomach issue. They all lead into the same issue. And I have been using these pelvic wands for a while now in various ways. Splinting, we just talked about, different trigger point like relaxation, using it with heat, or you can also use it with ice depending on what your issue is. I only use the heat, and things like that can really help your vaginal pelvic pain.
Yes, and we're going to save this and we can repost it, right? So we can, because I know a lot of people are going to want to watch this tonight.
Yes, and so many people messaged me and they were like, I am at work. Please tell me this. I was like, don't worry, we've got you. As long as TikTok doesn't glitch, we're good. Like, fingers crossed.
Yes.
Someone said, will Medicaid cover these? So FSA for the tools itself, and I believe Medicaid covers pelvic floor. I'm on Medicare, and they cover pelvic floor therapy.
Yes, Medicaid covers at least an initial evaluation with a pelvic health therapist in most states. There can be some differences state to state and how that is interacted, but I would say most of my Medicaid patients get at least 6 visits.
Yeah.
So we can do a lot of good, even an initial evaluation. We can do a lot of good in just that time.
I tell people all the time, I'm like, even if you can only go for an evaluation, just do it, because just knowing the difference if your muscles are too tight versus too loose can just open the door for like what types of exercises you should be doing, if you should be doing Kegels or not, like, you know, if you're doing things that are going to make it a little worse. So that in and of itself can just be so helpful. I wanted to thank you for teaching me what pelvic floor PT is, and now I'm doing pelvic floor PT. That makes me so happy. I love comments like that. I was really afraid at first to share about it on the internet, but I was like, you know what? I'm an open book. The only way that I'm going to help other people, have an easier journey than I did is by talking about mine and talking about the uncomfortable topics, which I'm not uncomfortable about. And, I've so happy about how many people have reached out to me about going to pelvic floor PT.
Jules, you're making them understand they're not alone.
Yes.
Which can save a life. I mean, honest to God, it saves lives.
Yeah, I was alone longest time. And I'm like, thank goodness I'm not. Like, this is an actual specialty that people do and work with. And then it wasn't just me, it was my sisters as well. Like, we were all able to get help. And they can help with, they can help with constipation. How do you pick a pelvic floor PT? Is there anything to look for specifically?
So there's a couple of different locators. One of the services that we offer is that if you email us, support@intimaterose.com, we'll help connect you with a pelvic PT in your area based on your zip code. We have a couple of different locators that we can use to help connect you. Some things to look for, keeping in mind that every provider is different and that there are individual and unique things that we all need out of a healthcare provider, and that we all have different rhythms and communication styles. But looking for somebody that has achieved training that is documented through either Herman and Wallace or the American Physical Therapy Association's Academy of Pelvic Health. And then also, if you have a specific condition, especially if you have endometriosis, you would want to ask them if they have training specific to patients with endometriosis. We have different levels of training. So ideally, you would get somebody that is fully certified or board certified in pelvic health. And then when you meet them, if you go in and they are a really smart and good provider, but it's just not a good personality match, listen to that, because it's important to have a therapeutic alliance with your person. And so sometimes you might need to see 2 or 3 to get the right personality match. But as a whole, we are really kind, wonderful
Yeah.
people. So hopefully you get your person on the first try.
I've only had nice pelvic floor therapists. It was interesting though. I made a video about it months ago. My sister was like home. It was before she lives here now, but before she lived here, she was just here for like vacation or something. And I was like, please make an appointment with Maggie, because she was going to pelvic floor PT where she lived down in Florida. But she was like, I just don't love it like you do. I feel like I'm not getting the same thing out of it. Like, we're doing different exercises than what you're doing. And I was like, well, maybe we have different issues. I don't know. And I was like, why don't you just come get a consult with Maggie? Like, while you're here. And she did. And she sat in on one of my sessions, and she was like, I learned so much in just sitting in my session than she learned in in her sessions with her own pelvic floor therapist. And she's like, that therapist was great. Like, she was knowledgeable and she knew what she was doing, but she wasn't explaining it to my sister as much. She's like, whereas Maggie, like, she was very thorough, making sure that you understood it. And she's like, that's what works better for me. And now she sees Maggie. But like, it's all about what's finding, what's right for you. Maybe some people don't want to talk about it all, and they just, want it to be done. And I'm like, no, teach me everything. I want to know every single thing we're doing.
And that's the right attitude. Absolutely.
Yeah. Someone said, can bad pelvic floor cause IBS? I think the opposite.
It doesn't drive the IBS, but the IBS can be worse as a byproduct of having a pelvic floor dysfunction.
Wands versus dilators. I don't really dilators that much. I used them originally, like with my first PT, just a little bit. But I mean, I own them.
Yeah.
I'm a wand girl all the way now.
Yes. So in some cases, both are indicated, and in some cases, it's one or the other. So in general, pelvic floor muscle dysfunction, where the pelvic floor muscles are too tight, they can drive pain. They can also make penetration, whether it's with a tampon or a medical exam or with a partner, difficult, if not impossible. So for people that are not able to tolerate much of anything at all, they are oftentimes receiving external manual therapy and physical therapy and learning how to drop and relax their pelvic floor. And then they would be starting with the dilators. And you can see here, our smallest dilator is the size of my pinky. We match. And the purpose of the dilator is to train the brain and the pelvic floor muscles how to coordinate and drop and relax to tolerate the sensation of something penetrating the vaginal or rectal opening. And we have rectal dilators too. So it's much more of it's almost like learning how to ride a bicycle or learning how to drive a stick shift, where you're learning a new muscle pattern, and then you're also training your body to not clench and guard against something coming in. So it's a bit more of a training program. Whereas with the wand, oftentimes people are using this for isolated tender points or trigger points or generalized muscle dysfunction, but they're already able to tolerate something going in, right? Because when we're using the wand, we're coming into different aspects of the pelvic floor muscles, or we're addressing tissue on the outer part here. So you can also see a world where somebody may have pain with penetration and they also have trigger points. So those two things can often go hand in hand. But the pain with penetration may be solved because it's a deeper penetration with the wand by reaching up and in there and getting it, versus people that have the sensory experience of clamping shut on something trying to enter. So for this reason, always important to see a pelvic floor physical therapist or occupational therapist to determine what your unique driver is.
For you. I have two constipation questions. One, does it help with constipation? And two, can a bad pelvic floor cause worsened constipation? Which definitely. Absolutely.
Yes, in this one, we can blame it on the pelvic floor.
Yeah.
Pelvic floor muscles are guarding can result in constipation because they cannot drop and relax and fully evacuate. And the wand can be a very helpful tool for patients with constipation. And you can address it vaginally because, again, as we talked about, the tissue that backs up here. So if we go in vaginally, we can be addressing the tissue that is right over the rectum. So with the organs taken out, you can appreciate how if we're addressing tissue here with the wand that directly affects that rectum, it's going to make having your bowel movement easier. But you're also learning how to control your muscles to relax and drop and open. So yes.
And then, can a uterine prolapse or cystocele make it hard to have a bowel movement and pass gas? Yes.
Yep, absolutely. They can create a blockage, which is really difficult to pass around, but that's where splinting and in some cases strengthening the pelvic floor to better support or use of other devices can be helpful.
Important to get that that exam at first. Consult, figure out which one it is and go from there.
Yes.
I think that's all I have over here. I think I got them all.
Awesome. You know what we can do too is we can always get back on here and do this again in a month or something.
But I'm free.
Awesome. I love it. Well, this has been so wonderful. Is there anything else that you would like people to know?
No, just don't be afraid. Like every consult I've ever been to, it's been really nice. It's been really helpful. And even if it's not the right match for you as that person, just the consult in general, I've always learned a little bit, and it's gotten me a little bit more comfortable with using things and knowing that something was wrong. And just knowing that something is wrong can be validating in and of itself and help your journey move forward.
Absolutely. I love it. Awesome. Well, this has been so wonderful. We're going to get this saved and we're going to continue to support you in any way we can. Please don't hesitate to let me know what you need. And thank you.
I've got my wands. I'm good.
That's all a girl needs in life. And if there's any other questions that come through after this goes through, we can always just jump back on and answer them together again because this just works perfect. I'm
excited. I'm happy to do this again whenever.
Awesome. All right. Well, have a great rest of your day and we'll keep in touch.
Much.
Take care.
Bye, everyone.